Joe Biden's equity agenda has a new target, kidney transplants. HHS proposal would push hospitals to prioritize low-income patients in a bid to address racial inequities. The Biden administration unveiled a plan that would push American hospitals to prioritize low-income patients when performing kidney transplants. A move the Health and Human Services Secretary Xavier Becerra says is aimed at rooting out racial inequities in the transplant process. The proposal, which Becerra's agency announced on May 8th, would place 90 of the nation's 257 transplant hospitals into a pilot program that uses an annual point system to grade participants. Under the system, a successful kidney transplant counts as 1 point. A transplant furnished to a low-income patient, however, counts as 1.2 points, thanks to a health equity performance adjustment, thus incentivizing the hospitals to prioritize such patients. At the end of the year, those points are applied to a transplant quota. Hospitals that meet their quota receive as much as $8,000 per transplant. Those that don't may have to pay up to $2,000 per transplant. While the proposal uses income to categorize patients rather than race, Becerra has made clear that the scoring system is meant to address racial concerns. In his statement announcing the proposal, he touted that Biden administration's concrete steps to remove racial bias in the transplant process. The organ transplant industry, like every other part of society, is not immune to racial inequities, he said. Black Americans disproportionately struggle with life-threatening kidney disease, yet they receive a smaller percentage of kidney transplants. The Biden-Harris administration is taking concrete steps to remove racial bias when calculating wait times and rooting out profiteering and inequity in the transplant process. The proposal reflects the Biden administration's fixation on equity. Shortly after taking office in January 2021, President Joe Biden issued an executive order outlining an ambitious whole-of-government equity agenda, in which federal agencies must recognize and work to redress inequities in their policies and programs. The Department of Health and Human Services kidney transplant proposal cites the executive order directly. The agency did not respond to a request for comment. I cannot imagine being turned away for a transplant due to the color of my skin. Like, that's kind of nuts. Or given like less priority due to that. Let's make healthcare more expensive. If a black person got a white kidney, wouldn't they become what they hate? I have no idea. Like, finding, woo! I almost dropped my bottle of ketchup. Finding somebody that matches, like it's a good match to receive a transplant, is hard as it is. And that reminds me of like, we read a story on here of this guy in South Korea who needed some kind of transplant. I can't remember what it was, but he needed some kind of transplant. And the nurse was able to find somebody who was willing to, like, give their kidney for the person who was dying. But the hospital found out about it, and they were like, well, we're not going to let this happen. I said kidney. I don't remember if it was a kidney. The nurse found someone to donate the organ, and the hospital was just like, yeah, we're not going to do this. And then the guy who needed the organ died. And I was just like, man, the entirety of, like, the organ industry is just weird. It's just weird. You need me to shake my ketchup for your friend who's never seen your stream before? Okay. Phoenix Silvertail, this shake is for your friend. It's a little watery because there's not a lot of ketchup left in it. I need a new bottle soon. Toby Turner's mom was denied a slot of the wait list because she isn't vaccinated. What the fuck? A lot of you were saying, sure, his quote-unquote friend. It's an article we read on stream. It was like a legitimate thing. But they were just like, yeah, no, we can't do this because he didn't wait on the list long enough. Well, it was a good shake. Need a shaking ketchup emote. We probably do, honestly. Probably seen it was line jumping, even though it shouldn't be part of it. Yeah, that's exactly what it was seen as. They're trying to do 3D printing of organs, so there's a way out of the transplant mafia. Oh my god. A fair shake! Where did I leave off here? For Dr. Stanley Goldfarb, a kidney specialist who served as University of Pennsylvania School of Medicine Associate Dean, the Biden administration's proposal attempts to sidestep the legal thorniness that would accompany making race an explicit factor in kidney transplants, while still achieving the same effect. This is a guy who served as a associate dean at the School of Medicine in Pennsylvania.
You can give me butt scratches,
and he's just like
I'm a real
yeah, we
pet.
wanted to make race an explicit factor for ages, but that was illegal. But thankfully now Biden is doing this in a way that sidesteps that.
Raised to pay for those that don't have insurance.
A repetent pasta, thank you for the 5. As with credit score, those paying into the system will have their premiums raised to pay for those that don't have insurance. Yeah, it's going to be basically that. It's the same that what Biden did with mortgage rates as well. Where if you have a high credit score and you're able to get a good mortgage rate, you're going to pay more on your rate to subsidize the people who don't have high credit scores. Sounds like a lawyer's wet dream. How can we subvert the law? That's pretty much all of DEI bullshit. They probably don't want to say, we're doing this for black patients because they know they're going to get into trouble with it, said Goldfarb, the founder of the anti-woke medical group, Do No Harm. What does he mean by anti-woke? And father of the Washington Free Beacon chairman, Michael Goldfarb. So these are ways around it to do what they're trying to accomplish. Under the proposed model, which Becerra's agency released through the Centers for Medicare and Medicaid Services, hospitals are given an annual score determined by 3 factors: number of transplants, organ acceptance rates, and post-transplant outcomes. The majority of a participating hospital score, 60 out of 100 possible points, comes down to the number of transplants performed in comparison to a government-determined transplant target, with low-income patients weighted as an extra 20%. Each kidney transplant that is furnished to a patient who meets the low-income definition would be multiplied by 1.2, thus counting that transplant as 1.2 instead of 1. The resulting count of the overall number of kidney transplants performed during the performance year, after the health equity performance adjustment is applied, would then be compared to the transplant target. Hospitals that meet the transplant target receive 60 points, the same number required to receive up to $8,000 per transplant kickback from the federal government. Those that don't can be penalized, starting in year 2 of the program. Hospitals that score a 40 or below are fined up to $2,000 per transplant. Hospitals that score between 41 and 59 neither receive nor owe money. And this seems a little weird, right? Because if they're receiving $8,000 per transplant kickback for this equity program, that means that it's us, the taxpayers, who are paying for these hospitals to induce racially motivated programs. Fined! Yeah, you're being fined for not picking the correct people to give transplants to. These government targets really worked for the Soviet Union, huh? In fact, it's so good it's still around today. Are these clowns aware that organs currently do not grow on trees? That's a little crazy. The proposal defines low-income patients as those who are in one or more of the following groups: the uninsured, Medicaid beneficiaries, Medicare, Medicaid dually eligible beneficiaries, recipients of the Medicare LIS, and recipients of reimbursements from the living organ donation reimbursement. The Biden administration considered making rural a low-income qualification, but opted not to do so.
Lost my glasses after randomly collapsing this morning. Gave me an excuse to shower and go outside early. Found them, but F my life. Have the equivalent of 10 Canadian funny money while I laugh at the stupidity of it all.
That would have been really funny, because aren't most people who live out in rural places, like farmers or, like homestead kind of people? Of course, rural's not in it. Too much conservative voter base? Yeah, right? Manya. Insolent! Thank you for the 690. I'm sorry to hear about your fainting. That shit's kind of scary when it happens, man. Jesus. Have the equivalent of 10 Canadian funny money. Well, I'm glad you found your glasses as well. Sorry you had a quite the non-fun kind of exciting start to your day. Help! I'm dying. We can have stem cells make specific organs, so you wouldn't need organ donors, but we can't have stem cell research because it's killing babies. Pancake Lee! Thank you for the 5. You're at Colossal Con and you saw someone cosplaying as me. It looked super epic, but you can't get a picture of it since your hands were full. Oh no! Oh no! Thank you for the $5. I don't even know what con that is. Can't help conservative voters. Fuck them! The proposal also concedes a potential concern regarding the program that it may incentivize shifting of kidney transplants from one type of patient to another. The proposal nonetheless dismisses that concern, saying that the health equity performance adjustment is meant to promote improvement activities that would increase access to all patients, while recognizing that low-income patients may face more barriers to care. 90 of the nation's 257 transplant hospitals will be forced into the program should it be finalized. The program could begin as early as January 2025, according to Becerra's announcement. For Goldfarb, the incentive structure at the core of the Biden administration's proposed equity initiative is misguided. Okay, so I got it a bit wrong when I talked about Goldfarb's quotes up here, because it sounded like Goldfarb was for the initiative when I was first reading it, but he's just pointing out how it's bad that they're doing it, I guess. He cited research showing that relatives of black patients are less likely to donate a kidney. HD, thank you for the subby bubby, my guy. Thank you. He cited research showing that relatives of black patients are less likely to donate a kidney, often due to issues that are unrelated to finances, such as pre-existing conditions. Medicare, meanwhile, covers the final stage of kidney failure for Americans of any age. I'm quite in favor of outreach to patients who have trouble accessing the healthcare system, Goldfarb told the Free Beacon. I'm just not sure this is the case with kidney transplants. I think it's much more a case of patient unwillingness to pursue this and families' unwillingness to donate kidneys. And so I think what they've just decided is, we'll just give an incentive to the hospitals to do this and let them figure out how to do it, he continued. But I don't know that there's a real system in place to allow that. So either you're going to have a system that ends up being purely on the basis of race, or it's going to be a system that fails totally. What? Obesity rules you out for live donor transplants? I mean, it makes sense. Nambona, thank you for the 6-month resub. Thank you. Thank you. Thank God my kidneys are good. Slothy, thank you for the 5. The solution for social malaise are embargoes on large cities. So hospitals are going to start putting kidneys into people that don't match, right? I certainly hope that's not the case. That would be really scary if they, to meet these quotas, just start putting kidneys in people that don't match. Because fuck the complications, right? Gotta meet that quota. Hospital incentives are the biggest cancer at your hospital. You get $3,000 per COVID patient and more for COVID death for expensive. There shouldn't be, like, quota incentives at hospitals. That's absolutely insane. Close enough. Oh my god. The DEI organ transfer performed by a DEI surgeon. Don't worry about it. Everything's fine. Everything will be fine.